My name's Emma Karran and I'm a postdoctoral research fellow, senior research fellow at the University of South Australia. I completed my PhD in 2018. I was interested in optimising the clinical management of low back pain. But my research as a postdoctoral researcher is interested in how the social determinants of health impact pain experiences and pain outcomes. And when I started to try and develop some understanding of that, I realised that in the health research that's published, there really isn't a lot of data that helps us, gives us that understanding, that a lot of information about people, who they are, their demographic characteristics, where they live, the environments of which they live, the social circumstances in which they live, is really poorly indicated in the research, which limits understanding of how treatments impact different groups of society across a range of differing social circumstances. And those social circumstances are really important from a health equity perspective. We need to develop a greater understanding of who is in studies, but really important, who is not in studies. So who are the people who we're failing to understand how interventions impact them, we're failing to optimise treatments to benefit often those who need it most. Often it's the people who are excluded from pain research because they are typically hard to reach. They're from low socioeconomic circumstances, they're lesser educated people, they're from racially or ethnically minoritized groups. They're not represented in pain research. So the research that I've been doing is aimed at getting researchers to take some steps to collect data that better captures that information from the participants in their studies, and do that in a standardised way. And alongside that, come up with, realise that they need to do better at recruiting more broadly across the population, so that they're collecting samples from people from quite diverse groups who typically haven't been in the research that we publish. So ISSUES is an acronym that stands for Identifying Social Factors that Stratify Health Opportunities and Outcomes. So this is a multi-stage project that I've conducted over the past 3 years that's involved scoping reviews, a big global Delphi study, a consensus meeting process, and focus groups with researchers and with people with lived experience from all continents. There's been very diverse contributions to this project, globally widespread, with the aim of developing recommendations for a minimum data set of key equity relevant characteristics that we would like pain researchers to include in a standardised way in all pain research. I have a team of 10 researchers in my core research group, in particular Professor Lorimer Mosley, who I worked closely with at the University of South Australia, who's a leading researcher in the pain field, but also leading researchers in equity, the equity field globally, and methods experts who have assisted me with this process over the last 3 years. And then I have a broader interest holder and advisory group, which is a globally represented group, people with lived experience of pain, journal editors, representatives from health funding organisation, clinicians, people who are really important because of their understanding of these issues, but also key players in our eventual aim of disseminating the findings of this research broadly. So I've published a protocol, 2 scoping reviews and the Delphi study, but the final outputs, the main results are being submitted in the process of submission to journals, and so hopefully they will be freely available soon. But I also have a website, www.issues.org, that includes an overview of our project, who's involved, what we've done, and includes links to the outputs as well. So the eventual outputs of this project will be available in many forms, which will be published on websites and recommended by varying organisations that promote quality in pain research as well.